Has you ever been dealing with that chronic instability or, persistent dizziness, maybe that awful head fog, and you go looking for help, right? And you get told, oh, the neck. No, no, that's probably not it. It must be the inner ear. Or maybe just stress. Yeah, if that sounds familiar, you know how incredibly frustrating that feels.
Yeah.
But today we're going to dive deep into some source material that, well, it strongly suggests that common advice might be a pretty big mistake. Okay, let's unpack this. The material we looked at points to the idea that the actual structure, the mechanics of your cervical spine, your neck, it seems to have everything to do with that long-term instability and disorientation.
That's exactly right. And our mission here really is for you, the listener who's been searching for solid biomechanical answers. We want to bring real clarity. We'll define the different ways people actually experience this disorientation. There are distinct types. And then crucially, we'll trace this surprising sort of specific chain reaction, how neck structure problems, things like disc issues, alignment, wear and tear, how they link directly to losing your balance and even, well, messing with brain function.
Right, like a roadmap, to understand something that feels really misunderstood. So we'll start by getting the terms right, the vocabulary you need to describe these feelings accurately. Then we'll explore that step-by-step biomechanical process, the compression idea, and finally look at strategies that target the root cause, not just chasing the symptoms. Okay, so let's start with clarity. When you just say you feel dizzy, that one word, it covers a whole lot of different pretty unpleasant physical sensations, and the source material really emphasizes that understanding the nuance, the specific kind of feeling you have, is absolutely key for getting the right diagnosis.
It really is. We need to differentiate between four main experiences. First, there's what we call true vertigo. The sources use the term vertigo. This is that intense spinning feeling, like the whole room, wall, ceiling, floor is just rotating around you. It's often severe.
Really disorienting?
Extremely. Often leads to bad nausea, vomiting. Sometimes you just can't even stand up.
Okay, so vertigo.
Yeah.
The world spins around you. Got it. What's next?
Next is dizziness. The sources called this Mario. Now, this is quite different. Here, the environment around you, the walls, the room, it feels stable. It stays put. But you feel unsteady. You feel wobbly on the ground, almost like you're a bit intoxicated, maybe. You just can't quite anchor yourself properly.
Ah, okay. So the difference is internal versus external movement perception. That makes sense why just saying dizzy isn't enough for a doctor, right?
Precisely. And that leads to the third type, permanent instability. This isn't spinning, it's more subtle. A constant feeling of insecurity or like stationary objects are subtly moving. People describe things like feeling the car sort of swivel when they glance sideways while driving,
Right.
or looking at a screen and the text seems to waver or distort slightly.
Or letters moving when reading.
Exactly that. It's this persistent sense that things aren't quite stable visually or spatially.
Well, that sounds incredibly tiring to live with day in, day out.
It absolutely is. And then the fourth type is head fogginess or heaviness. Embotamiento was the term used. This is less about movement and more a sensation like your head is being squeezed or weighed down from the outside. It often registers as pressure or even pain, sometimes mixed with a bit of that instability feeling.
And it's often not just the dizziness or instability, is it? The source material talked about associated symptoms too, those other weird neurological things that seem to tag along.
Yes, and the list is quite revealing, which is part of why it gets so confusing. You often see things like memory issues or a mental fog, forgetting simple things, struggling for names. Blurred vision is another common one, even if your eye doctor says your prescription is fine. And people report sharp, stabbing pains in the eyes sometimes. And of course, tinnitus, that ringing or buzzing sound, acouphonous inside your head or ears.
Yeah, you put all that together, the weird symptoms, the constant feeling of being off balance. It's easy to see how that would take a serious emotional toll.
Absolutely. The sources really highlighted the psychological impact, especially for people who, value feeling in control. Chronic instability feels like losing command of your own body, and this often triggers really intense reactions. Deep insecurity, feeling distressed, anxiety, even panic attacks or depression in some cases.
And stress makes it worse.
Well, the sources noted that external stress, work pressure, personal stuff, relationship issues doesn't cause the physical problem itself, but it definitely seems to amplify the symptoms. Makes everything feel much harder to cope with.
Okay, so before we really zero in on the neck itself, we should probably just acknowledge briefly that the sources did mention other potential causes that need ruling out first.
Right, definitely. Instability can come from the inner ear, that's the vestibular system, your body's balance center. That's a common starting point for diagnosis. It can also link to the jaw, the temporomandibular joint, TMJ, especially if you clench and grind your teeth a lot, that's bruxism.
All right.
Or less often, it could be neurological, like a small stroke or ischemia. Those need consideration.
Despite those possibilities, the material we analyze really points towards the cervical spine, the neck, as being the principal cause in many chronic cases,
Yeah.
the one that's frequently overlooked. So what is it specifically structurally in the neck that's kicking this whole thing off?
Yeah, what's fascinating here is how specific it can be. We can break it down into roughly 4 structural problem areas. First, disc problems. Discopatias was the term. Issues with those gel-like cushions between the vertebrae. Think herniated discs, bulging discs, maybe discs that are just deformed or even ruptured.
And whiplash plays a role here.
A huge role, according to the sources. Whiplash, latigato cervical, especially from rear-end car accidents, even minor ones from years ago, is a very common, often missed cause of long-term disc damage that shows up later as instability.
So an old injury catching up with you, basically.
Exactly. Then, beyond the discs themselves, you have alignment issues, like the natural curve in the neck straightening out, that's called rectification cervical, or even reversing, which is quite serious. And finally, just wear and tear, degenerative changes, or corrosis, the joint surfaces wearing down, or specific joints getting blocked or stuck, articular blockages. Any of these structural things can set the stage for the whole dizziness cascade.
Okay, and this is where it gets really interesting, right? Because the body's reaction, the thing that causes the dizziness, is actually meant to be protective. It's like a defense mechanism gone wrong. Can you walk us through that step by step? Why does a structural neck problem lead to feeling unsteady or foggy?
Okay, so it starts with the brain sensing trouble. When there's a structural issue, say that disc problem or misalignment, the brain recognizes, okay, this area is compromised, it's unstable. Its first command is protect.
Protect by stopping movement,
Yeah.
by putting on the brakes.
Precisely.
Yep.
Protection means clamping down. It forcefully contracts all the muscles surrounding that injured or unstable spot. The muscles tense up, trying to stabilize it.
Like a natural neck brace made of muscle.
Exactly. It's an internal brace.
Uh.
But here's the crucial point where things often go wrong in treatment. That protective muscle tension, that's what you feel as chronic pain, stiffness, those knots in your neck and shoulders.
Right, the symptom.
The symptom, yes. And very often, people seek treatment for that tension. They ask for a deep, strong, maybe even painful massage, a descontracturante massage to release it.
Yeah, makes sense. Get rid of the tightness.
It seems logical, but the sources argue it's profoundly counterproductive in this situation. Why? Because you're forcefully relaxing and destabilizing the very structure the body is desperately trying to protect. You might actually worsen the underlying instability, or at least signal to the brain that its protective measure failed, prompting it to contract even harder later on.
Wait, hold on. So that really intense massage that feels good for maybe a day, it could actually be telling the brain the area is less safe, making the underlying problem worse long term.
That's the core insight here. You're essentially fighting the brain's protective programming. Now, whether you get that kind of massage or not, that constant underlying protective muscle contraction, it starts to squeeze things. It compresses vital structures running through that tight neck area, like the nerves going up to your head, scalp, eyes, ears.
Which could explain things like the tinnitus or those sharp eye pains.
Exactly. Compression of nervous structures. But that's only part of the picture. The sources really zero in on the oxygen link. The really critical compression is on the vascular flow, the blood supply.
The blood vessels.
Yes. Think of those constantly tight muscles, like a clamp or like stepping on a garden hose. They are squeezing the blood vessels that feed the brain. This prolonged tension reduces the quantity and maybe even the quality of blood reaching the brain.
Wow. So the body's attempt to protect the neck structure accidentally ends up kind of choking off the brain's blood supplies. It's like a major blockage or more subtle.
It's usually more of that slow, constant throttling rather than a complete cutoff. But the final link in this chain reaction is clear. Reduced blood flow means reduced oxygen. And that lack of good quality oxygen and blood flow reaching the brain caused by a mechanical issue, the protective muscle spasm that is presented as the root cause of the dizziness, the instability, the head fog linked to the cervical spine.
So the dizziness isn't random nerve signals firing off.
Mm.
It's a symptom of the brain not getting enough oxygen because of mechanical compression in the neck.
That's the mechanism laid out in the sources, a kind of localized ischemia, essentially.
Okay, that completely changes the game, doesn't it? If the dizziness and the muscle tightness are just consequences of poor oxygen delivery, then the goal isn't just to loosen the muscles. It has to be about fixing the underlying structural problem that triggered the muscle tightening in the first place.
That is the only way, logically, to convince the brain it's safe to release that protective contracture. You have to address the base issue, and the sources suggest specific approaches depending on what that issue is. For example, if it's primarily a herniated disc,
Yeah.
they mention treatments like ozonotherapy, injecting an oxygen-ozone mixture around the disc to potentially reduce inflammation and help stabilize it.
Okay, and what if it's more about alignment, like that straightened neck curve or stuck joints?
Well, if it's an articular blockage, a joint not moving correctly, or a significant alignment problem compensating for something else, then chiropractic care chiropraxia might be the route to restore proper joint motion and alignment.
And for the wear and tear, the arthrosis.
For advanced degenerative changes, arthrosis, the focus might shift towards osteopathy. Or using certain phytochemicals, vitamins, and minerals. The goal there is often more about trying to slow down the degeneration and manage the surrounding tissues, rebalancing things.
Right. So those are very targeted interventions aimed at the root structural cause. Once that's being addressed, what about supportive measures? Things to help the body finally ease off that protective tension and get the blood flowing properly again.
Yeah, good question. Across the board, the sources really hammer home nutrition as the absolute #1 foundation for recovery and stability.
Makes sense. Fueling the system.
Definitely. Beyond that, supportive things could include supplements aimed at helping muscles relax naturally, and massage can be beneficial.
But the right kind of massage.
Exactly. Therapeutic, gentle massage, not that deep, painful kind we talked about earlier. And critically, only after the underlying structural issue is being effectively managed and stabilized. The goal of this gentle massage is to help ease the residual contracture and improve circulation without triggering that defensive tightening response from the brain.
Okay, and that brings up one really specific detail you mentioned earlier. The sources advise against using heat. That seems counterintuitive for tight muscles.
It does, doesn't it? But yes, the recommendation was specifically not to use heat for this particular issue. The focus needs to remain on structural stabilization first. Then, gentle methods to help lengthen and relax the muscles, decompress those vascular channels, and restore that consistent quality oxygen flow to the brain. That's the ultimate aim. So if we were to boil it down, the key takeaway for you, listener, is this. That persistent dizziness, the brain fog, the instability, it might not just be your inner ear acting up. It could very well be linked directly back to the mechanical health of your neck, your discs, your alignment. These issues trigger a protective muscle tightening,
Right, the internal brace.
which then acts like that pinched hose, reducing vital oxygen supply to your brain. And that lack of oxygen manifests as these really debilitating physical symptoms and often significant psychological distress like anxiety and insecurity too.
And looping back to that protective muscle tightening.
Mm.
It's crucial to remember the tension itself isn't the problem. It's the signal. It's the brain saying, this structure down here is unstable.
Hmm.
So the real goal isn't just forcing the muscle to relax temporarily, but fixing the structure so the brain finally believes it's safe to let go. Which leaves us with a final thought, maybe something provocative for you to consider. If your neck is constantly sending out these painful muscle signals because of a hidden structural issue, where else in your body might you have chronic pain, maybe your low back, maybe a shoulder that you've been treating as just a muscle problem? Could it actually be your nervous system desperately signaling a deeper instability that needs addressing at the root? Something to mull over. Okay, that's all the time we have for this deep dive. Thanks for joining us. We'll catch you next time.